Today we saw a lot about Discovery Bot, right? And how to actually use that in concert with making it easier to find processes to automate. And I've seen over 85% of the top life sciences companies around the world be able to adopt automation. They get ROIs, they are really responding to the challenge the industry is facing and trying to be more customer-centric or patient-centric to deliver on the promise of their mission, right? And being more fiscally responsible. But the top thing that we hear is that CEOs are looking to move their people into higher value work. You know, I'd love to hear more about that in terms of how you see this innovation being able to drive better health and better outcomes for both the device side as well as the patient side.
Yeah, absolutely, and the physician. So when you talk about high value work, what's more valuable in the physician's day than actually talking to patients, diagnosing them, hearing their stories, showing empathy, and being able to be the critical decision maker to then come up with a treatment plan or guide them through their patient journey. And yet we find physicians spending so much time doing data entry.
Right.
And then so the EMR was supposed to be the liberator, and yet we know that that's actually hasn't proven to be as useful as it was intended to be. So there's opportunities for automation there. So how can we free up physicians from doing work that could be done by technology so they can get back to the practice of medicine? So from the patient and patient advocate perspective, that is of a huge interest. Let's free up physicians so that technology makes their work easier and more high impact. And also their satisfaction with work could get back to the roots of feeling like they're helping people and they're saving their lives as opposed to they just have to do a lot of manual work. What if we could shorten that long cycle, by 6 months? What kinds of opportunities could that provide for cancer patients who are waiting for that next drug to save their life? I have goosebumps just because as I think about what technology could do to actually make a difference in people's lives and improve their health and make their lives easier and better, that's phenomenal.
I know, and we're sitting here with practical AI, with the ability to take AI and integrate those disparate or siloed databases to create faster drug discovery or the ability to use more information available to us in a more productive way. And really what we're seeing things in life sciences and some of the pharma and medical device companies is the ability to get there faster. So speed to market, better complaint handling, better claims processing, faster cycle times, just the ROIs achieved are less than 12 months. And what do you do with that capacity? Well, we want to all be better humans. So we want to take the robot out of people so that we can do what humans do best, care for people, empathy, solve problems, create solutions, deal with disasters that are happening and the needs to create fast and rapid responses to things like the coronavirus and items like that, right? So how is we as a human society going to be able to do that? We've got to use the tools associated with Automation Anywhere, with AI and Discovery Bot in order to make it possible for more people to use the tools to get value out of it sooner, right? Irma, thank you so much for being here today. It's amazing to celebrate Intelligent Automation Day with you, and I really appreciate you being here today.
Well, thank you, Catherine. I appreciate being invited and having this time to spend with you and your team.